Hello, everybody. Yeah, I'm waiting for the comments. So at the end, I will be answering all your questions. So we will talk about acid reflux as we discussed. We're telling you 5 mistakes that usually people do, and the 5 tips what you can follow in order to alleviate and help with the acid reflux. First, let's see what is acid reflux. So acid reflux is actually or GERD, esophageal disease, they call it, which shows actually that when the acid is coming into the esophagus and causes burning in the middle of the chest. Is it caused from too much acid or a lower acid? So some people think it's I have too much acid in the stomach, so I need to lower it, or is it because it's lower acid and we need to increase the acid? So we will go deeper now into this and explaining everything what is actually going on. And I will be answering the questions at the end. Please stay tuned. One disclaimer in the beginning, I have to say this because this is not to treat any disease, or it's not like a prescription, or this is just for informational purposes only. It's not to, because I don't know anybody individually, your diseases, your lifestyle, your medications you are taking. So this is just for informational purposes only, and my experience and my knowledge. Okay, what are the symptoms that people are experiencing when they have acid reflux? Symptoms are heartburn, indigestion, bloating, constipation. I will explain why this happens, bloating and constipation. Bad smell, of course, because there is disbalance in the bacteria in the stomach and they are overgrowth and you have a bad smell. Burping is a symptom of actually having acid reflux. Then trouble swallowing because it's tightening of the esophagus. Frequent hiccups. So every day or every other day, if we have hiccups, that means that actually we are having acid reflux. Excessive saliva production, like we want to chew more, because we're producing more saliva and the body is trying to get rid of it and we want to chew more, chewing gums like that. Then you feel pressure in your chest, like here. This means this can be a sign of having acid reflux. Clearing throat, like all the time doing like that, or coughing a little bit, Sinus infection can affect also the ears, the lungs, and the vocal cords. So the voice is like a hoarse voice. You can some people experience changing in the voice. Nasal drip, allergies. This can like mimic allergies. So people think they have allergies and take antihistamines, which actually the problem lies in the acid reflux. Berets esophagus, and that is because the acid is coming into the esophagus and there is the tissue is being damaged and there is inflammation going on, and it's called Barrett's esophagus. Hiatal hernia, it's actually similar thing when the tissues, the cells from the stomach goes up in the esophagus and it creates like expansion, and it's like a balloon is blowing there. It's called hiatal hernia. Then H. pylori. H. pylori actually thrives in the pH between 5.5 and 7.5, which is a little bit going through alkaline. The stomach pH is between 2 and 3, which means we need more acidic in order to remove the H. pylori. Next, when you eat, let's say, too much acidic food and you have affected sinuses, ears, lungs, and vocal cords, then if you have candida yeast infections, this can be a sign that it all started from the acid reflux, from the stomach problem with the acidity. First, we need to explain how our digestion works, how actually the normal healthy stomach should work. And I explain more in detail in my YouTube channel, All for Better Life. If you want, you can go there. And now I will explain briefly how normal digestion works. Normal digestion works when we, let's say, first smell the food and the saliva is being produced, and then the stomach is getting ready to accept the food. And what does stomach do? Of course, it produces HCl, hydrochloric acid, and this acid is very acidic, which is between 2 and 3 pH. And it's very, if you put a drop of this acid on an iron, it will make a hole. So imagine how acidic this is. So how come this acidity is not burning our stomach? Because our body is very smart and it's producing, the stomach has a glandular glands, cells which produce mucosal. So this mucosal lining is covering the stomach wall and it's protecting it. But these glandular cells are not in the esophagus. Okay, so esophagus is not being protected from this acid, only the stomach. Normally, with years, when we are younger, we produce more acid, and when we grow older, our body produces less and less enzymes, less acid production. So how come people who are older experience acid reflux, which should be, if we have more acid in the younger age, then the younger people should experience acid, but it's not the case. So people who are older, getting older, they experience more acid reflux. So it's actually by having a less and less production of the acid. If there is, when we eat this food, when the pH becomes between 2 and 3, then the esophagus muscle, the sphincter, it closes, and then the digestion starts to break down the proteins, the meat, to absorb the nutrients, the vitamins, minerals. But if the pH is not getting as it should be, if it's higher, then the esophagus sphincter doesn't close. Okay, stays open, and then the food and the acidity can come into esophagus, then we experience acid reflux. And after that, when the nutrients are absorbed, like B vitamins are absorbed in the stomach, and magnesium, calcium, and iron, okay? So when the stomach acid is at pH 2 and 3, it triggers later on the bile to be produced from the liver and to be excreted from the gallbladder, actually, to continue digesting the fats, and it's triggering also the pancreas to produce the enzymes. Okay, so lipase, protease, and amylase. So this is all connected. If the stomach is working properly, all the other organs are working properly and are producing the enzymes to continue digest the food and to absorb all the nutrients that we want, that we need, right? And enzymes in the stomach, like pepsin, that is the one who helps breaking the proteins. And if the esophagus is not closed, it can travel up into the sinuses, in the throat. It can it can sit on the vocal cords and in the middle ear and in the lungs. We need to remember that it takes 3 to 4 hours for the stomach to digest the food, to go further down, the food to move. So, but if you lay down after a meal, the stomach, the food, and the acidity can come up. So usually, the first time I experienced this acid reflux is when I was pregnant. So, from the belly, it's making pressure on the stomach, and the food comes up into the esophagus. So usually people who are obese, who have big bellies, they experience more acid reflux, and people who overeat. So we need to eat smaller meals in order not to have big pressure and the acidity to come into esophagus. The acid reflux is actually developing in 60% of the population, and studies can show that 30% of men and women above 60 are suffering from atopic gastritis, which is literally no stomach acid. And another study shows that 40% of over the age of 80, the people don't produce stomach acid at all. The problem lies in the esophagus muscle. So it needs to close in order the acid should be in a proper pH in order it to be closed. And if it's not closed, it's creating all the problems, because it's from the pressure building up, and it's becoming up in the esophagus and burning the esophagus, right? So in the stomach, we also absorb the B vitamins like B12, folic acid, vitamin C, and the stomach acid is also killing the bacteria, fungus, all the microbes that are bad for us, and it's like a first defense for our immunity. So if you don't have enough pH, we allow the bacteria and yeast to proliferate and to overgrow in the stomach and further down the intestines, right? If there is enough acid, so the valve would close and the acidity did not come back. And this is also happening, the valve to close. the normal digestion in parasympathetic state. Parasympathetic state is when we are in a rest and digest mode. We are not in the stress mode, and because during the stress, of course, the digestion doesn't function properly. Even if we eat the best food, it will not the enzymes will not be produced, the acidity will not be correct. So this happens at the normal digestion only in parasympathetic nervous state. So the more stress we have, the more acid reflux we have. Have you noticed that? I have, of course. So if we eat like on a run, just run, and then we eat without having to sit down and relax and eat in a relaxed mode, or if we eat on a go, then people experience more acid reflux. When the HCl, as I said, is in a correct pH, it triggers the bile to be produced, and the fat-soluble vitamins like A, K, E, omega-3 to break down. Is breaking down the fats, of course. So without enough HCl, if the HCl is not enough, the bile is not produced, so we don't break down these fats and we don't absorb these vitamins and minerals. So people have vitamin deficiency like B12 deficiency, iron, and then we allow the bacteria overgrowth in the small intestines because they're not killed with the acid in the stomach, and they will overgrow and create bloating and constipation and pain in the stomach. Also, we create yeast overgrowth, like candida overgrowth. So we make because they proliferate, they overgrow in more to the alkaline environment. That's why we need more acidic environment for a better digestion. Okay, so we need the right pH in the stomach to keep the H. pylori in check. Because H. pylori also it thrives between 5.5 and 7.5 pH, and H. pylori is actually thriving in that environment, and it's also stopping, inhibiting the production of the HCl. So it's a vicious cycle. If we have H. pylori overgrowth, it's very difficult to eradicate. Also, if we are low on zinc and not enough HCl, it creates ulcers. And it needs zinc also to produce the HCl. So if we have zinc deficiency, we will not produce enough HCl. Also, we need the sodium chloride, like a salt, to make HCl. Potassium also, and this is all the raw material that we need, our body needs in order to produce normal HCl. So also, what causes acid reflux? It can be caused by also by smoking. Some people are vaping. They said, oh, I'm not smoking. I don't inhale this toxic material. But vapes, they're just eliminating tar. But people who vape also develop esophageal cancer. And one study in the UCLA in San Francisco shows that chemicals used in vaping, like propylene, glycol, and some related compounds, they have identified 5 of them, and they are causing an inflammatory response to the lungs, to the vocal cords, and some scientists, respectful scientists, have said that these chemicals, if they're inhaled, that cause cell transformation and creates cancer cells, that they become cancerogenic. Okay, so and eating this and inhaling, because some people say, oh, I don't inhale, the cigarette, but you cannot say, because this doctor is like an ENT and he was doing so many surgeries on esophageal cancer with the people who are vaping, who are smoking. You don't tell the smoke where to go, right? Also, the acid reflux can cause allergies. So if sometimes people go tested for allergies and they say, oh, my test is negative, so I don't have allergies, because it mimics the allergy symptoms, nasal dip, sinus infections, and you think you have allergies because these substances from the vaping, from the smoking, it causes swelling to the tissues, it causes inflammation, pressure in the sinuses, and it mimics the allergies. Okay, because nasal drip, you can feel it, you think it's allergy. So it's very important to what you eat, what you drink, and what you inhale. Also, chronic stress, as I mentioned before, can reduce the prostaglandins production, and we need prostaglandins, which are molecules that promote the healing process. There are healthy inflammatory molecules that promote the healing of the tissues. So if we're under chronic stress, we cannot heal. Even if we have like esophageal damage or hiatal hernia or burnt esophagus, burning, indigestion, if we're still running on stress or stressful mode in the sympathetic state, we cannot heal. I hope we all know that already. What we can do, so people, when they experience acid reflux or some pain or burning, usually go to the doctor and do endoscopy. Brings the camera inside your esophagus, and it can see everything what's going on, if there is an inflammation going on, and they can take also a biopsy to check if there is H. pylori, and it's good thing to know what is going on. The tissues are inflamed or is nothing damaged yet, you just have acid reflux, and it's much easier if it's in the early stages, it's much easier to be fixed. Next, usually the doctor, it's not done, this test is not done, or even if it's done, the doctors prescribe proton pump inhibitors, PPIs, or antiacids. So there are two types of these medications. Some of them are proton pump inhibitors. It's inhibiting the cells to produce acid. It means it's stopping production of the acid. The other ones are alkaline, and they are making the environment alkaline, like Thums, or which is calcium carbonate, or Gaviscon or soda bicarbonate. It's just neutralizing the acid immediately. You get instant relief. So some of these also of these antacids, which are readily prescribed, it's called Zonex, Prilosec, Privosed. So I don't know if you are using some of them. Nexium, Tagament, Protonix, Acifax, Zagret, Melax Omeprazole. Many of these are prescribed like candies from the doctors. I'm not saying this is bad thing, because sometimes this is very helpful, and it was when these were discovered, it was like a miracle. People were taking these antacids or PPIs, and they had instant relief. The doctors were saying, okay, you just take this pill and you can eat what you want, right? So people were getting used to this, the pill to fix all their problems, right? And they can continue with their life, whatever they were doing. And they get instant relief. Wherever they had issues, they just take the pill, and the symptoms are gone. But we need to understand the underlying cause of what is actually going on, and how this can affect and create larger and bigger symptoms and making bigger damage in our health. These PPIs and antacids are actually, you can buy them anywhere. Like they say in Costco, you can buy a huge box and you can use them anytime you want. And people spend like $200 monthly on this, on regular use of these PPIs, because doctors were telling patients that they can use them for a lifetime, because this is a magic pill, right? So yearly the expenses goes like for 2,000 euros per year on antacids. Okay, so a typical PPI will suppress 80% of the acid production for the next 12 hours. Okay, so you have to keep this in mind. But there are other less strong antacids like ranitidine, famotidine, Zantac, Pepsid, which reduces 40% of the acid acid production only for 4 hours. So if you really need to take sometimes, just be aware which ones you will take. Okay, so I want to explain the side effects of these antacids, which is very important to know. I mean, the doctors should know them, because I believe if they're aware of the side effects, they shouldn't tell their patients to use the PPIs for lifetime. If you read on the box, it says you can maximum time to take it's 14 days. It's not for a lifetime. So what are the side effects of using these antacids and PPIs for a longer period of time? So if we neutralize the acid in the stomach, as we mentioned, we will become B12 deficient. So I think most of my clients are deficient in B12, in B vitamins, in magnesium, like iron, also calcium, and can lead to numbness, nerve damage, brain function, or tingling hands or feet, or memory problems. Osteoporosis, bone fractures, because you don't absorb the calcium, there is not enough acidity to absorb the calcium in the stomach, and you get the osteoporosis with years. Of course, I'm not telling that this can happen right away, but usually the elder woman experience fragile bones. Decreased resistance to infections and illness, as explained before, the pH actually is killing the bacteria and the viruses and microbes. So if we are not, if we don't have enough pH, we are not killing them, and we become more prone to bacterial overgrowth and infections. We can catch any infection and any illness or yeast overgrowth. And C. diff, which is very common bacterial overgrowth. The people who are using antiacids on a regular basis, they experience overgrowth of C. diff. You can check these two and check and see that one if you have an overgrowth. Then restless leg syndrome. If you're using antiacids, you can experience this one. Food allergies. So food allergies usually are developed from a prolonged use of PPIs, like Privosed and Melax Omeprazole. In 2009, the American Journal of Gastroenterology is showing a possible link in long-term use of the PPIs and food allergies like gluten, dairy, soy, corn, peanut, tree nut, and eggs. And corn and soy, for you to know, it's in every label, almost in every food on the market, and because it's a filler. Some of the symptoms are also not being able to catch your breath when you're outside. So like you think you have an allergy, you cannot get the full breath, or you're feeling like out of breath. So this is some of the symptoms. Then going to bathroom or peeing very often, like every 15 minutes, 30 minutes, you need to pee. Kidney problems, inflammation in kidney stones also from taking these Thums, calcium. Usually for osteoporosis, then the doctors prescribe calcium, which is not going into the bones, but is actually going to the kidneys, creating stones. Thinning hair, vomiting, then increased risk of cancer, especially esophagus cancer, allergies and asthma, depression, anxiety, and mood disorders, anemia, as I said, B12 deficiency and iron, skin diseases, acne, dermatitis, and eczema, gallbladder disease and gallstones, autoimmune disease like rheumatoid arthritis, then Graves' disease, and type 1 diabetes, IBS, which is logically that it's caused from the low stomach acid, and it's actually the second cause of missed work. So people are not going to work because of IBS. It's the second cause after the common flu or cold. So imagine how many people are suffering from IBS, irritable bowel syndrome, then Crohn's disease and ulcerative colitis. So if there is not enough pH and we take PPIs, we are lowering more, it can create Crohn's disease and ulcers, chronic hepatitis and osteoporosis, as I mentioned. So this is from chronic use of these PPIs. So the PPIs relieves the sensation because it makes the pH like to be 5. It's still acidic, but it's not where it should be, like between 2 and 3. And when it's pH 5, it travels back to the esophagus because the muscle is not being closed. We know that it's closing when the pH is in the right level between 2 and 3. So if it's 5, it doesn't close the muscle and it travels up into the esophagus and into our mouth. And as I said, the bacteria cannot survive in pH 2 more than 15 minutes. More than 15 minutes. Okay, so but if it's higher, the pH, they can survive and they can continue traveling into our small intestine and create bacteria overgrowth into the small intestine. Does anybody has any of these symptoms that I mentioned? Because I mentioned so many symptoms that people think are normal with the aging. We will have these symptoms. It's normal with aging, but we need to connect the dots why these symptoms are coming. Maybe because we are using these antiacids and PPIs on a regular basis. So in one trial of 30 people with GERD, with acid reflux, they were treated with Prilosec 40 grams a day for 3 months, and 11 of the 30 developed significant bacterial overgrowth from taking these antiacids. So there was a trial, they checked, and people experienced bacterial overgrowth. And then you have bloating, then we have constipation and pain, abdominal pain. So as I said, H. pylori is one of the bacteria which overgrowth, and it increases with age as stomach acid production decreases, right? So as we age, our stomach acid production decreases, and the enzymes, of course, everything is less produced, and we have more of the H. pylori bacteria overgrowth. And the H. pylori further decreases the stomach acid, and we develop chronic heartburn or GERD. Okay, so low stomach acid creates a maldigestion of the carbohydrates. Okay, because the enzymes from the pancreas will not be secreted if the pH is not on the right level, and carbohydrates will not be broken down. And what happens now? Bacteria overgrowth plus maldigested carbohydrates equals to production of gas and bloating. So if there is not enough stomach acid, they will be broken down before they reach the small intestine. Okay, if there is enough stomach acid, they will be broken down. But if there is not enough, it will be digested by our microbes that sits in the small intestine, and they will ferment the carbohydrates because it's carbs, and it will create gas and bloating. So many people have noticed that when eating carbs, they experience more bloating, right? So when they eliminate carbs like gluten, bread, pasta, they feel relief. So this is all connected with having a low acid in the stomach. Some of the bacteria which can overgrowth are Salmonella, Campylobacter, Cholera, Listeria, Giardia, and Clostridium difficile. So if we don't have enough stomach acid, and we don't bring the food properly, and we don't absorb the nutrients properly, and we allow the bacteria overgrowth. So if people are having pain, what normally we do, we take painkillers like Brufen, right, which is a standard common painkiller, or paracetamol, which is common for our everyday use to kill the pain, right? I have been using them also, but the thing is, if we are using these painkillers on a regular basis, these are chemicals that are damaging our gut wall and creating ulcers. So we have more pain, and we have and if we increase the acidity, we think we have low acid. If we increase the acidity, we take some, I don't know, apple cider vinegar or something. We burn these ulcers, and we feel more pain. So it's all interconnected. Like I said, when we think we have low acid, we need to eat more acidic food in order to have more acid. But if we have esophageal tissue damage, irritating, we will have more pain. And uncontrolled acid reflux, which will be happening for a longer time, can lead to esophageal cancer. And that is the fastest growing cancer in America and Europe since 1970. Okay, so what happened in 1970? In 1970, the government allowed, actually gave an order for the people not to have food poisoning from the food, and the bacteria not to grow in the food. They allow them to the companies to make all the food which is in the can, in the bottle, and in the box to be acidified to pH 4.4. Okay, and they were allowed to add ascorbic acid and citric acid to make the food more acidic. And then cancer went up, the esophageal cancer. So the food industry shifted from cane sugar and beet sugar, which is the healthier version of the sugar, to high fructose corn syrup, which is a cheaper, and it's inflammatory sweetener. So please read the labels. And some of the chemicals in the corn syrup, in the preservation of the food, they loosen up the esophageal muscle, and the acid from below the muscle, it slowly is going up and increasing the inflammation of the esophagus tissues, and possibility for cancer, developing cancer. So 75 million of Americans have acid reflux, which is 20%. But not everybody have the symptoms, you know. Some of them have silent acid reflux, and but some of them may be having like constant cough, and they don't connect, you know, that this may be from the silent acid reflux, or they have hoarse voice. It's very important, so what you eat and when to eat. sometimes, if this is happening for a prolonged period of time, if the irritation is continuous of the esophageal tissues, they become numbed. So you don't feel it. When you burn your hand for more times, then it becomes numb. You don't feel it. Doesn't mean it's not happening. It doesn't mean that we don't have acid reflux anymore. Some people are saying, I used to have acid reflux, but I don't have it anymore. They think it's healed, but they're still continuing with the same lifestyle, and they're eating the same and drinking the same, but they think their acid is healed, and they're not realizing that maybe the tissues are numbed and they're not feeling the effects of the acid reflux to the tissues. So 15% of the people with throat symptoms, that maybe they're coughing, they feel they have throat irritated, maybe after a meal or after drinking something. 50% of the people with these symptoms will potentially have precancer or berets esophagus, which is actually damaged cells of the esophagus. And 50% of them will become cancerous because stomach cells are creeping into the esophagus, okay, which they shouldn't be there. But if they're constantly coming up, and the cells from the stomach will go up in the esophagus, creating Barrett's esophagus and maybe later hiatal hernia. This can be checked with the endoscopy or camera going through the nose, and they can see what actually is happening and what have you developed if you have something. Okay, so what to avoid? Let's see. We need to avoid most of the acidic foods. Some people have already commented on my question, and most of them are right, exactly. And the most acidic food are coffee, which has pH 6. It's not that acidic, but it's creating acidic environment and feeling that you have acid reflux. Cacao, chocolate, of course, our favorite one. Alcohol, mint, raw onion, and raw garlic, because this loosens the muscle of the esophagus, okay? And then what happens? Our acidity from the stomach comes up. So we need muscle to be closed tightly. So these are the 6. They're not that acidic, but they're everything which is below 4 is extremely acidic, and we shouldn't eat like sugary diet, soda, and bottled iced tea. But there are some healthy things that may create acid reflux, and we should avoid them if we are suffering from acid reflux. And those are the citrus fruits, okay, like oranges, lemon, grapefruit, like that, tomatoes, vinegar, wine, because it activates tissue that produces pepsin and creates swelling in the sinuses, irritates the lungs, and body-wide inflammation response created. Okay, so then you should avoid spicy foods, no fatty foods. Of course, if the pH is not at the right level, the bile is not produced and the fats cannot be digested. So during the healing process, we need to avoid these kind of foods. So spicy food, peppermint, sugar, processed food, carbohydrates, I explained before why, grape juice, orange juice. Have you noticed that some of these are aggravating your symptoms? Many of the people who have reached out tell me that like grape juice, they were thinking it's healthy, of course, but it's causing huge symptoms like burning mouth symptoms or burning esophagus. So it can creep up and cause like sinus infections, nose dip, anything. But it's a healthy food, people are recommending this and you think it's a healthy food, but while healing, you need to avoid. Usually it's better to take something to neutralize these acidic foods, and it's the abbreviation is CARS, so it's coconut, almond, rice, and soy to neutralize this acidity of the pineapple, oranges. So if you're sometimes taking this acidic food, just add something to neutralize the acidity of this food. I see this as a blessing, if somebody is experiencing this, so it will go deeper to understand it better. I see it as a blessing to address the cause and to address the symptoms and to address the food and change the lifestyle. It's like a wake-up call. So we shouldn't be eating crappy food or garbage. We shouldn't be feeding our body like that. So we need a healthy food. Successful treatment is the treatment is actually the same like healing the leaky gut. So we are following the 4 steps. Is the same. But we have plus one step with fixing the acidity. So the first is eliminating the triggers, the triggering foods, then healing the tissues, healing the gut, healing the cells to regenerate and to regrow. The middle one is restoring the acidity in the stomach. And then the third one is bringing back the good bacteria and feeding them, so they will give us the benefits of the nutrient absorption and feeding our cells to perform optimally. Okay, so treatment is reducing the bacterial overgrowth. Okay, we are doing that with the treatment, and healing the esophagus sphincter and increasing the stomach acid. Okay, so what we need to reduce? We need to reduce the carbohydrates because fermentation of malabsorption of the carbohydrates because of low stomach acid produces hydrogen gas, and actually this gas is preferable source food for H. pylori to feed off. So people are noticing improvements when they remove or reduce the carbohydrate. And this is how you reduce the H. pylori overgrowth. So sugar, starches, and grains also to avoid. Yeah, there was another study also that shows carbohydrates increase GERD, so which is proven, and maybe you have noticed the same. So by reducing, you reduce the acid reflux. Also, some people are taking anti-inflammatory medications like corticosteroids, prednisone, aspirin, ibuprofen, like painkillers, Advil, Motril, or other non-steroidal anti-inflammatory drugs, because these drugs damages the GI lining, and if your GI lining is damaged, and you think that you need to increase the HCl by taking supplements like HCl and betaine, and this will aggravate the symptoms, and you will feel more pain, and it can create gastric bleeding or ulcer. Okay, so that's why it's not like a one treatment fits all, right? It's not like if somebody have helped their symptoms with taking HCl and betaine, it doesn't mean that it will help alleviate symptoms for somebody else who have different lifestyles, who have taken different medications, and have maybe developed damaged tissues inside the intestines and the stomach and the esophagus, right? So supplements to take, as I said, is HCl. Proper way, if it's in the beginning of this acid reflux, the symptoms, if the tissues are not damaged, so you can take HCl and betaine, but the way it should be taken 3 before each meal, and next day you need to take 4, then 5, then 6. You just increase every day until you reach the point where you feel like burning, like hot in the stomach actually. And then you need to back up one step, like if you feel burning with 7, then you reduce 6 and you continue taking them for a longer time until you fix completely the acidity in the stomach. But in the same time, we need to address the stress, we need to address healing the gut, the regenerate the tissues, and it should be a complete body healing. It's not just one supplement fix all problems. Okay, so we need to get enough potassium and sea salt. These are the basic nutrients that helps in production with HCl, our stomach by itself to produce HCl. Then we need to add zinc, chew the food longer, of course. When we chew the food, it signals to the stomach to produce the HCl. But if we just swallow, the stomach is not ready. Okay, and if the food stays longer in the stomach, it cannot be digested properly and can be ferment and create bloating and all the things. So keep the stress down. This is important. So only in the parasympathetic state we digest the food properly. People can add Lactobacillus acidophilus before bedtime, which is shown best to produce the HCl. It's helping. Also bitters, like eating bitter green leafy vegetables, increase the production of HCl, bile, pepsin, and gastric acid, and also pancreatic enzymes. So it's triggering all the digestive enzymes and juices to be produced, and the food to be digested, and the nutrients to be absorbed. And they also stimulate the motility. The motility is also important. So we don't want stagnation. When there is stagnation, there is bacteria overgrowth, yeast overgrowth. So we want the food to move throughout the intestines and to be eliminated properly and regularly. Then barberry bark, caraway, dandelion, fennel, and ginger root, artichoke, golden seal, milk thistle, wormwood, and yellow bark. Okay. Then apple cider vinegar. People sometimes see apple cider vinegar very helpful, but for some people that have ulcers or that have already burnt tissues, it may aggravate the symptoms. Okay, so they need to focus more on the healing side. Then bone broth, it's rich with proline and non-essential amino acids, which are important for production of collagen, okay, and to regenerate the tissues. Glutamine is also essential metabolic fuel for the cells, and DGL, a deglycerized licorice, helps with gastric and duodenal ulcers, and it works by raising the body prostaglandins that I mentioned before, which are signaling and healing mechanism. They have sending signals to heal these tissues. Okay, so many people have problems on what to eat and have difficulties in finding a good meal plan to start eating. So they need like a recipes, like a meal plan, and starting with no gluten, no dairy, and no sugar is the way to start. But sometimes for people, this is overwhelming and they don't know exactly what to eat. They need the recipe, they need the meal plan. Or some people, you know, they say, oh, I cannot live without my favorite crackers, or without my favorite cookies, or my favorite salad dressing. You know, I cannot live without that. It's very difficult. I understand many people find it very difficult to stop consuming some food which is added with acidity and with chemicals that are loosening our esophagus, and now we understand why we should eliminate this kind of food. Okay, so also we can consume more dark leafy vegetables, almonds, broccoli, salmon, sardines with bones, of course, because it's the natural calcium that we need. And the normal diet should be like PFC instead of KFC, so proteins, fats, and carbs. But carbs from vegetables, of course. And most people do well when following a proper diet plan with recipes. Okay, I said more than 5 mistakes and more than 5 tips, but I will summarize, like we are already talking a long time now. I will summarize. So 5 mistakes: taking PPIs, smoking, acidic food for somebody, stress, and anti-pain medications. Okay, 5 tips. So don't overeat, reduce the stress, take the supplements, avoid caffeine, alcohol, carbs, and remove medications. Slowly, you need to get off the medications, which are actually aggravating the symptoms and causing further imbalance in the system. Before I ask the question in the group and in my page, and I have so many good answers, what do you think? What is the reason for acid reflux? And Dr. Salman said white sugar, smoking, overeating, overweight, painkillers, ibuprofen, coffee, fatty, spicy food, chocolate, and increase of progesterone and estrogen of the hormones. Yeah, hormonal balance is also important. Says mold and H. pylori, of course. Mold is like a yeast overgrowth. So we allow, if there is disbalance, if we have a higher pH in the stomach, and the mold and the fungus, they thrive in the higher pH. So if it's very acidic, they cannot live, they cannot survive. So when we have higher pH, if we are exposed to mold, we experience all the symptoms, and we can have fungal overgrowth and histamine reactions. Okay, Dean says low stomach acid, correct. So the problem is in the low stomach acid and the esophagus sphincter too close. That's very important. Brooke said hiatal hernia. Yeah, hiatal hernia is actually a result of having a low stomach acid. Martin said coffee, correct. Michelle said acidic food. Yes, for some people acidic food are aggravating the symptoms if there is damaged tissues. Amanda said that her husband reduced his GERD by not drinking coffee on empty stomach in the morning and refined sugar, and he has smaller servings, so he's not overeating, so that's good. Sonia Ivanova, she said the esophagus sphincter is fragile and allows the return of the chyme. Chyme is the mixture of what is going on, food and acidic the acid in the stomach, and it's coming back in the esophagus. Completely right. So we need to strengthen this muscle and its contractions. Key nutrients: collagen, protein, iodine, calcium, and saturated fat. Okay, this said low stomach acid, correct. Susanna said taking HCl and betaine, fired it for for 3 years. She healed it with that one, but dropping and from them and taking digestive enzymes, and she was on strict IIP diet for rheumatoid arthritis, but symptoms came back, and again starting taking HCl and betaine again. You know, sometimes these supplements helps, of course, but unless we follow the certain steps in proper order, in the healing, the complete healing will not happen. So if we stop the supplements and if we are still maybe doing the same things, then the symptoms may come back. Rheumatoid arthritis and any other autoimmune diseases are connected with having a leaky gut. So healing the leaky gut is the correct way to go. And Jennifer says, I think I have an ulcer, so it's making mine worse. Yes, correct. As I explained, the taking HCl and betaine in having an ulcer will cause more pain. Fiona says it helps not to drink anything during meal. Yeah, that's also good. It's correct. So if you drink something, will dilute the acidity. Marty says h.pylori. H.pylori is like a refraction of the low HPA, so it's like a result of having low HPA. It's not the cause. Okay. So it's not like people think that, okay, I have H. pylori and I need to kill it and take antibiotics. So it's making bigger disbalance down in the intestines, further down. Okay, so we need to create, to change the environment, and the H. pylori cannot survive. Sue says SSRIs, selective serotonin reuptake inhibitors, you know, this for antidepressants. Of course, that's medications, and medications are damaging our stomach lining. Bleeding ulcers, of course, it can cause bleeding ulcers, definitely. Let's see the questions here. Angie asks, can an overgrowth of oral thrush cause inflammation to the brain? Yes, so oral thrush, it's actually coming from the yeast overgrowth. From low stomach acid, we allow the yeast, the candida, and everything to overgrowth and cause the mouth thrush in the tongue. And yeast overgrowth, it is sending molecules to the brain. It's creating brain fog, memory issues. You know, it's these are the toxic substances that yeast produce. It's very good to address the acidity of the stomach, to avoid this food that I mentioned, and establish the balance. Okay, Ishar says, informative topic, keep up the good work. Thank you, Ishar. Ali? And G is asking how many milligrams of B12 is safe. So I don't know what are your results, but some people are getting shots, you know, B12 shots, which are very good and restoring the B12. I believe, in my opinion, the shots are better because are bypassing the digestive. Because if you don't have enough stomach acid, even if you take through the mouth the B12, maybe it will not be absorbed again. So while you're healing the digestive tract, it's better to take the B12 shots. Okay, Dr. Salman says, we have many medicines for indigestion, heartburn, acidity, acid reflux, IBS, etc. in homeopathy without any side effects. Yeah, homeopathy is also good. We are usually treating patients according to the body symptoms individually. Exactly, yeah. So that's what we are doing. Yeah, exactly. So everybody is individual. We need to know the symptoms, and we need to adjust the treatment accordingly, of course. Angie asks, is it safe to use turmeric and echinacea for stomach problems? Depends, Angie. Some people, I have some clients who, turmeric is anti-inflammatory, we all know, but some people are sensitive to turmeric, of course, and instead of being anti-inflammatory, it's causing the inflammation in somebody's body. but generally these are anti-inflammatory, and echinacea is good to take generally if you don't have any symptoms, if you don't react to that. I think it's okay, should be okay. Okay, so we are wrapping up. If you want to know more about the healing process, the steps that I'm following, you can watch the 3-part video series on healing the gut naturally. And if you have acid reflux, we will add the one more step in the healing process, and I will post the link in the comments. And if you have any other questions, you can send me a message. So stay safe and see you next time. Bye.